If you have this issue or any of these conditions where maybe you have some numbness, tingling in your hands, and it feels like every time it hurts and you're getting some tingling down there, but it feels better if you put your hand up, that's a condition that we treat regularly. Hey guys, Dr. Eric Smith. In today's video, I have Brandon here, and so I wanted to bring Brandon in for a few reasons. Brandon, I met through the course of just being in Chicago and such, but one of the great things I like about him is he's a trainer. Obviously, he's a great physique, and he's a very well-educated man who works with a lot of different clients. And where do you work again?
So I'm at Strive Village over in River North.
Okay.
Yeah.
So downtown Chicago, River North area, is at Strive? Right?
Strive,
yes. Yeah. So great place to train a wide variety of different people that they work with and such. So the other thing too is Brandon has a very good holistic health, take care of your health, be in charge of your health, take care of your life, and be in that for yourself, because nobody else is really going to help you with that unless you reach out, but you need to make and take those decisions for yourself.
Sure.
So some of his viewpoints in terms of health, he falls right in line with what we do chiropractically. So I wanted to treat the man. So because obviously he's helping other people by moving well and getting their life in check, and so we're going to treat him. So his main complaint, and what did you come in for first?
So mainly I just have a lot of restriction in my left shoulder. I can't get it full external rotation, but I have pain here on my neck right into that shoulder.
Yeah. So some of the biggest things I noticed with him, because if you see he has very strong pecs, and you may have that as well, that your pecs are nice and big, but if your shoulders start to roll in, which he's been actively working on that and bringing his scapula back, and kind of how he mentioned, but because it's pulling still through here, I noticed on him that he has a lot of his lower neck, so down here, really jammed up, and also what's called his first rib. So the first rib has a lot to do in this area with bringing the shoulder up, which sometimes will create a click that he just felt.
Mm-hmm.
And so the scapula is moving, but right here through his clavicle, which goes into his AC joint, isn't moving very well. So he can work on the mobilization of this, but if this first rib, which is really, really hard to mobilize on your own, isn't moving very well, he also will have a hard time taking his head all the way to the left. And if you see, he bends through here, he doesn't bend through here very well because this is still jammed up. Versus if we go to the other side, still kind of same restriction, and you got a little pop there. Yeah, exactly. So we need to get with him, which a lot of people have, especially if you have a wider chest through here, is getting this loosened up in here, because it's super, super hard for you to do on your own. So I'm going to show you how we're going to do his adjustment. I'm going to work on him a little bit with that. And when we get done, I'm going to have my assistant Morgan. She's going to be doing some stretches with him, using a cold laser and some other therapies that we do, which provides what we call the optimal health advantage. Other chiropractors or physical therapists might not do as much as we do. So if you have questions about your care, feel free to comment below or give us a call, okay? So Brandon, I'm going to have you lay down, face down for me, please. So he's clearly got some muscle to him, so I'm going to use a vibrational massager first. And I keep getting a lot of questions about massagers and what to use. So there's a wide variety of different things. There's some that are more impact. They kind of look like power tools, if you will. This is more vibration. I'm using this in two different ways, really to kind of get him loosened up, which I'm pushing a little bit deeper in those areas, trying to dig into his levator scap, and then in his traps, and just kind of getting this loosened up. So from his hard day of working with people and everything, and you got kiddos, right?
I do.
How many?
2
Two boys, right?
girls.
Two girls.
Yeah.
So I can't imagine why he's got some stress and everything up here. I can only imagine when they get older, right?
Oh man.
That's great. So you're busy dude. How old are they?
5 and 2.
5 and 2. So busy dad, taking care of his family, taking care of himself, taking care of other people, and so we're glad that he's in here. So in terms of his condition too, something you see is he's got some very well-developed back muscles. But we want to start working on this curve here in your back, because this is what we call the primary curve, or your kyphosis. And you have what's supposed to be 2 lordoses that go like this. So in your kyphosis, if this is too big, you'll end up kind of hunched over, which is creating this angle, and now his shoulders are here when they should be back down and in the best mechanical position. So if they're here and forward, and this is tight, and his back's there, he's also going to have a hard time with his motions of like pressing overhead. Pull-ups are going to be a little bit harder, and he's going to stress his shoulders way more than the activation of his back. So he does have some motion in there, but we're going to work on increasing that too. So his low back, there's a few things that I noticed. when I was looking at him, and I like to work from the ground up to kind of see what's going on. His feet are off a little bit, and his pelvis is rotated too, as you can kind of see. It's more rotated like that. So we're going to work on a few different things with him. So let's get right into the adjustment. We'll start in your thoracics first, okay? Right through here. Nice deep breath. All the way out. Good. Very good. For these ones, I want to get your ribs to open up. So I'm going to have you just drop your arms to the side. Good. Just relax. There we go. Good. And so, in terms of how I like to get into the first rib here, is now that he's laying face down, the muscles will usually relax. So what I like to do is just let the patient just let their arms dangle, and I'm going to get right into this area. So I'm pretty much going to pull his neck to the side and get in there and open that up in two different ways. So let all the shoulder relax. Good. 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 Just relax again. Perfect. Awesome. Go ahead and lay on your back for me, please. Feel okay? Mm-hmm. All right. So in terms of your neck and how it works too, is your lower ones, your lower joints, so your C7 pretty much going up through there, they do this lateral flexion we were talking about. So we're still encouraging and trying to get this to be a little bit easier with him. And you can tell there's a muscular component to it because I can actually now move his ear here. But if I told him to do it, he's probably not going to be able to because his muscles are still used to firing a certain way and restricting him. So that tells me the joints are looser, and I'm still going to try to increase this range of motion. But still through here it's stuck. So I know I still need to work and adjust here. And that's a way that we as chiropractors typically find like where to adjust, because I get that question a lot. How do you know where to adjust? Do you just pop and crack? No, there's a method to what we do as chiropractors with adjustments. We don't just try to get everything to pop. Good. Very good. All right. So we're going to get the thoracics now. Tuck your head, or tuck your chin. Yes. Good. Awesome. So we got some movement out of the thoracics with that type of movement. I like to use my body weight and then help them, because now the body can move the thoracic vertebrae the way they want, as well as kind of get some rib involvement. So I'm going to work on his low back now. Before I do that, I'm going to loosen up his ankles, get into his knees, and then into his hips, which we saw that his pelvis was off a little bit. I'm just going to loosen both of these ankles up. Let this relax. Good. Awesome. And deadlifting?
Yeah.
Yeah.
Well, yesterday.
He has the war wounds. This is just a mobilization of the knee. So I'm pulling and then opening it up and moving it in a fashion that he typically can't. Let this relax. Good. So when I said I start from the ground up with these things, I want this to be working the best it can, so his hips can be loose, so it'll allow the low back to move the way that it should. If these things are all messed up, how do you expect, like if you were going to build a house, how do you expect it to be level and look good at top if the basement's all messed up? So let's fix your low back now. Go ahead and lay on your side and face me. So with him, he has pretty good lordosis where his back curves in. So I'm actually going to drop his leg off to a little bit different thing where I can induce a little bit different curve. Good. Let's lay on the other side. And just try to open those sacroiliac joints up a little bit. Perfect. All right. I'm going to have you sit up with your legs facing that way. Yeah, there you go. Cool. So before, we were looking at his lateral flexion. So let's try to move your head to the side. A little bit easier to do.
Yes.
Let's go to the other side. Good. So he's still really tight through here, and that's more of a muscular thing. As we continue to work on him, I think this is our second visit together. We're going to work on getting that loosened up. Those also are the same areas that the nerves go to kind of like this part of the hand. So everything is lifting, doing. We want this to work as best as possible by taking the pressure off the brachial plexus and everything working. So if you have this issue or any of these conditions where maybe you have some numbness, tingling in your hands, and it feels like every time it hurts and you're getting some tingling down there, but it feels better if you put your hand up, that's a condition that we treat regularly. If you have any questions, comment below. We'll see you next video.